Hello and welcome to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining us this hour is Diamond Fernandez of the HeartFit Clinic. Welcome, Diamond.
Thank you very much.
It's great to have you back here, Diamond. Happy New Year.
Happy New Year to you and everyone out there.
For sure. New year, new start. Lots to talk about today. The most important thing is how we can improve our heart health. For those folks who have not heard of the HeartFit Clinic, can you give us an idea of what this awesome clinic is all about?
Thank you. The HeartFit Clinic is a cardiac rehabilitation and heart attack and stroke prevention clinic. So we see people who already do have heart disease at any stage of heart disease and all types of heart disease out there. There's congenital problems, there's valvular disease, and of course coronary artery disease. And then we also see people who want to prevent a heart attack or stroke. So we have some great assessments to find out what people's risk is of a heart attack or stroke.
Heart disease is the number one killer and the number one cause of hospitalization of men and women. It's not breast cancer. In fact, it will kill more women than all cancers combined. That is an astonishing stat.
It is. And not to dismiss what happens in the other side of things, but, heart disease does get a lot of people. And it's important that it is also, in saying that, is the number one preventable disease, meaning that you don't have to go down that path if you start to focus on some really key things that we'll talk about during this talk here.
For sure.
Yeah.
The HeartFit Clinic here in Calgary, fantastic clinic. You can find out lots online if you want to check out their website. It's heartfit.ca. heartfit.ca. I'll also be mentioning the numbers throughout the hour, but if you want to grab a pen and paper, 403-870-4348. Diamond is going to give us some great information today about heart health, how to prevent it, how to treat certain conditions, and how the HeartFit Clinic is really the only place in this part of the world, without getting on an airplane and flying south, that you can get some pretty cutting-edge treatments. So 403-870-4348. That's 403-870-4348. If you're out of the calling area, it's 1-877-700-4348. Again, we will be repeating those numbers throughout the coming hour. So maybe, Diamond, walk us through it. Tell us a little bit more about the clinic and what you offer for people and what you're all about.
So we are a clinic that we see people, again, that do want to find out what their risk is of a heart attack or stroke. And that could be at any stage of their disease. So obviously from a preventative side of things, it's important to take more control into people's hands, give more control into people's hands to find out what your risk is of a heart attack or stroke. So let's... I always like to start off by saying, family doctors are really good at just giving you a generalized overview of what your risk is of a heart attack or stroke. They can check for your blood sugars. They can check if you have high cholesterol. That's really about it from that standpoint.
Sure.
If you're overweight or if you are not exercising or you're not eating well, I don't know if that gets really addressed unless you have a really on top of it doctor that way. But, those are important things to all look at.
For sure.
But, people, if they want to know what the risk is of a heart attack or stroke, a family doctor is not really the place to go to. So they may refer you on to a cardiologist. Now, on a preventative level, a cardiologist can do two non-invasive tests. They can do an echocardiogram, which is an ultrasound of the heart. They can, of course, look at the electrical signal of a heart even while walking or running on a treadmill, and that's called a stress test.
Right.
The problem with that is that it is a dated test. It's been around for a long time, but it'll only show advanced stages of a disease. So what I mean by that is if we think about our... let's say our arteries are like a plumbing system. And people think, okay, well, when the plumbing is clogged up, when the drain is no longer, draining, then that's when we have a problem. And that's exactly when it'll show up on a stress test.
Okay.
When it's, it's not draining as well.
Right.
And that's too late.
Okay.
That's way too late. And so the point is that, yes, if you are at increased risk, then that's obviously you'll go down that path of seeing cardiology investigations, but we'll talk a little bit about some other options that we do at the HeartFit Clinic in that state as well. The point is that you might get a clean bill of health from even a cardiologist and still be on the path of a heart attack or stroke.
How is that possible?
So if you look at the blockages, the majority of heart attacks actually occur when blockages are less than 50%.
Really?
Yeah.
You have to explain that more.
So, it sounds quite shocking, but many people think a heart attack will occur when our arteries are completely clogged up. But a 50% blockage or, something in and around that range, when it spills or bleeds its contents into the arterial wall, it can go from a 40, 50, 60% blockage to 100% blockage very quickly.
Sure.
Yeah. And people think that, okay, well, if I don't have high blockages, 80, 90, 100% blockages, I'm okay. And the truth of the matter is all about the stability of the plaque inside an arterial wall. And so what we do at the HeartFit Clinic is we focus on doing some screening tests to see what your risk is of a heart attack or stroke along that way.
Okay.
Yeah.
You're listening to Talk to the Experts here on News Talk 770. We are chatting with Diamond Fernandez of the HeartFit Clinic. Their website is heartfit.ca, and the number to reach them is 403-870-4348. That's 403-870-4348. And long distance, 1-877-700-4348, 1-877-700-4348. Okay, so Diamond, for those people who have angina, heart stent, bypass surgery, tell us, what can they do? Because there's a lot of listeners out there that are going to fall into or know people that fall into those categories.
Of course. And, obviously those screening tests that we can do, it's a good way of keeping track of people's disease process. The only way that you can see what's going on inside your arteries is doing an angiogram,
right?
Which those people who've had a stent or bypass or, have coronary artery disease will understand that test. It's where we look right inside the arterial walls. They go through the wrist now, and they basically navigate their way to the heart, and they can see exactly what's going on inside the heart. Now, that's obviously quite an invasive test, and so you're not going to get that test on a preventative level. You actually have to have had a heart attack or actually have to have some pretty severe angina to go down that path.
Sure. So somebody that ends up in the hospital, they've got the chest pains and the symptoms, they've had to call 911, they've had that, or unless they've had prolonged chest pain and those symptoms, right?
Yeah, absolutely. And so when you look at that, I mean, we have some great treatment options that we can do to focus on that. And our treatment options, obviously, with external counterpulsation, we'll talk about that here shortly, but external counterpulsation is a great treatment option for those people who do have coronary artery disease, that have what we call angina. And, if they're taking medications or they're going to have a heart stent or bypass surgery on a stable perspective, this is where external counterpulsation, also known as ECP, would be a better treatment option for those people.
So maybe explain ECP. We're going to get a little bit more into it later in the hour, but give us the nuts and bolts.
So ECP is a natural treatment to heart disease, and it's very evidence-based. It's not something that's hocus pocus out there or anything like that.
It's not necessarily brand new.
No.
The only place you can get ECP in this part of the world is here in Calgary.
That's correct.
But it's been around for a long time.
Absolutely. And it's been around. It was FDA approved back in, I think, in the late 90s. For angina and congestive heart failure in 2002. It's, recently been obviously mentioned with the European Cardiology Society and the American Heart Association talking about ECP. And it's kind of, I'm going to talk a little bit about it from a cardiology perspective, because obviously I attend a lot of cardiology conferences and I go to all that. I mean, been doing this for the late 90s now. And so it's been a long time and a fun career doing this. I absolutely love helping people prevent and reverse heart disease. And the idea with that from a cardiology perspective is, and I see them all the time, is that they're trained to try and find out what the best means available to them to find out what the extent of heart disease you do have.
Right.
And then they have treatment options that are available to them. So either they want to stent it, bypass it, ablate it, which is kind of a burning process, or they want to medicate it.
Right.
So that's kind of their regimen. And when we talk even about, we know the benefits of exercise. Everyone knows the benefits of exercise.
Yeah.
How many cardiologists actually recommend that as a really good treatment option for patients? How many cardiologists really talk about the benefits of stress management? How many cardiologists talk about eating very well? In my opinion, I got a book coming out, as we know, and I just finished the manuscript, which is really exciting.
That is exciting.
And so that's off with my editor right now. And it's about 5 pillars of heart disease. And I'll talk about that a little bit later. But the point is that, with exercise, nutrition, stress, those are important things to focus on. And external counterpulsation therapy falls in that umbrella. it is a repetitive treatment that people have to do to help them with their heart health.
Right.
And it's kind of like glorified physiotherapy.
Okay.
So the point is that a cardiologist may not have this in their toolbox. And I know they don't have it in their toolbox here in Calgary. So it's not going to be perhaps the number one recommended choice to, if you have, okay, look, we're going to do a heart stent or a bypass surgery or to open up your arteries or grow new arteries, you might want to consider external counterpulsation therapy.
Okay, so I need you to stay tuned because we're going to hear more about ECP. It's fascinating, and the only place you can get it is here in Calgary. We also want to talk about those 5 pillars of heart health, and as well, we're going to talk a little bit more about why the majority of heart attacks actually happen and what you can do to prevent them. You're listening to News Talk 770. This is Talk to the Experts. I'm Betty Jo Kaiser, and we'll be back shortly. Hello and welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining me this hour is Diamond Fernandez of the HeartFit Clinic. HeartFit.ca is their website. Very easy to navigate. Great information. HeartFit.ca. And their number to reach them, 403-870-4348. That's 403-870-4348 or 1-877-700-4348. Just before we broke, Diamond was explaining about ECP, external counterpulsation therapy. It wasn't that long ago that if you were recommended to get this type of therapy, you needed to get yourself on a plane, go down to the Mayo Clinic or one of the other big clinics, private clinics in the U.S., and in order to get the treatment. But HeartFit Clinic here in Calgary offers ECP, external counterpulsation therapy. It sounds awfully fancy, but the truth is, it's pretty easy to explain. It's pretty straightforward.
Yeah, it's pretty. And I think the number one question people get is it safe?
Yes.
And it is safe. Obviously, we go through a very thorough assessment, and you see our cardiovascular nurses before you come on to that bed, the treatment. And what happens on the bed is that patients lie on this bed. It's a comfortable bed. You got these cuffs that go around your calves, your thighs, and your buttocks. And they sequentially inflate, and it does that according to your cardiac cycle. So every time your heart is relaxed, the cuffs inflate, and when the heart contracts, the actual cuffs deflate. So it does this according to your heart cycle. So if you're beating, 60, 70 times a minute, which is where people usually, when they're lying down and they're in a relaxed state, that's how many times a minute this bed is actually moving. And so what happens during this procedure is patients will lie in this bed for about an hour, and it kind of feels like a massage. And it's a safe treatment. It's kind of painless. If you can withstand a massage or a little squeezing aspect of it, then that's what it feels like.
Excellent.
And so what happens is patients lie on this bed, you're monitored by our nurse the whole time. And the cool part about our program is it's a repetitive treatment. So we do this, obviously, the treatments happen often. Mm-hmm. And
do you go once a week?
Yeah, we usually like to go daily.
Oh, okay.
And it depends on the severity of patient's disease, really.
Okay.
And that's what it really depends on. And so the idea is to complete the treatments within about, a couple months.
Okay.
And, we like to do about 30-ish treatments and kind of go through that aspect of it, pumping blood back up to the heart. And what happens during that process is it actually, now you're pumping a greater volume of blood, so it actually helps grow new arteries. It improves a whole bunch of things to the actual arterial wall. And we have the inner lining of the arterial wall that it helps out with. And of course, the growth of new arteries is always a benefit to patients who do have angina, that do have coronary artery disease, and that do have heart failure. So it basically exacerbates the benefits of what we can do with exercise, because patients exercise is good, and there's so much what we can do with that, but external counterpulsation therapy is a great option for that as well. And with our clinic, of course, that's what we focus on. So we focus on the treatment side of things. We have exercise programs, we have nutrition programs, stress management programs, and external counterpulsation therapy. So it's not just about doing that. We educate people while they're with us on the benefits of all those things.
Awesome.
Yeah.
So if someone listening here, they have angina or they are the perfect candidate for this type of treatment, they come to the clinic, they get an assessment, and between management of exercise and diet and stress and possibly ECP, that's how you help create a better, happier, healthier life, right?
And I'm going to get right into it. I mean, I love this treatment. And the reason why I love it so much is because of the benefits that we get from our patients. And I used to do this treatment back in 2005 when I was in Dubai. Was it 2005, 6? I can't remember now, but it was a while ago. And that's where I was actually introduced to it. Mm-hmm. And I saw the benefits then. And now, many years later, we have this bed. And, we opened up our clinic in 2007, the HeartFit Clinic. And the benefits that I'm seeing from the patients just makes me smile from ear to ear. Because when I can hear a cardiovascular surgeon tell a patient, we're not going to do bypass surgery on you anymore. We'll wait a little bit.
Yeah.
Or, we'll put it on the side table for now.
You're doing well.
You're doing very well.
You're improving.
And it really takes a strong person to be able to say, okay, what else is out there for me to help with my disease process? Because, and I'm going to get a little philosophical for a second, is that you might have heart disease, but heart disease doesn't have you. And that's a very important concept, because many people, when they've been diagnosed with heart disease, it becomes them, it doesn't have to be that way. And if you can find options, which is what we do at the HeartFit Clinic, to get better, to help people prevent disease, to push off a heart stent that is not required yet, or push off bypass surgery, those are huge things.
For sure. You're listening to News Talk 770. This is Talk to the Experts, and we're chatting with Diamond Fernandez of the HeartFit Clinic. Heartfit.ca is their website. Reach them by calling 403-870-4348. 403-870-4348. Long distance 1-877-700-4348. So, Diamond, tell us why the majority of heart attacks actually happen and what we can do to prevent them.
So what you can do to prevent them, of course, is coming to see us or talk to us. We got some great resources on our website, of course, and coming to see us at our clinic. We have some great things to help you out to find out what you can do to prevent a heart attack or stroke. But why the majority of heart attacks occur, it comes down to, you could see a cardiologist and get a clean bill of health right before a heart attack. And you end up with a heart attack. And people always, and I can't tell you, the many years that I've been doing this, how many people have come to our clinic and said, I got a clean bill of health from my family doctor. I got a clean bill of health from my cardiologist. And I still ended up with this heart attack. Why
it's all about the blockages.
It's all about the blockages.
I know that much.
Exactly. and the majority of heart attacks actually occur when blockages are less than 70%. So it won't show up on a big test. So when you look at a block, actually less than 50% is one of the studies that I saw that we have on our website. It is that, and the reasons of that is that when you have a plaque or a blockage covering 50% of a heart artery, you still got blood flow going through that artery.
That's right.
Right? It's still going through that artery. The problem is if you have an unstable plaque that breaks off its contents and spills its contents into the arterial wall, you can end up going from a 50% blockage to a 100% blockage very quickly. And that's where a heart attack can actually happen. And that's where the majority of heart attacks actually occur.
I got to tell you, if you go on to heartfit.ca and scroll down to near the bottom of the main page, the home page, there's an excellent diagram that explains what Diamond is talking about. Sometimes people understand more visually.
Absolutely. Yeah.
And it really explains that blockage. And I can picture, just looking at the blockages here, this diagram in the middle of the page, when you get the ECP, the external counterpulsation therapy, imagine the blood just whooshing through there.
Yeah.
And that's really what it does, right? Does it help clear it out?
Well, the idea is that now with ECP, the idea is that it's a treatment option for those people who do have coronary artery disease.
Right.
Right. And so it helps improve the endothelial function of the arterial wall, improves the stability of those plaques.
Right.
So it prevents them from, breaking away, going from a 40% blockage to 100% blockage really quickly.
Right.
And that's very important at what that does. Obviously, in combination with what we talk about with our clinic, we're a whole focused clinic on lifestyle intervention.
We've only got a couple more minutes left in this segment, so we're going to start on this. We'll see how much time. We might have to push it to the next bit, but I want to know about these 5 important tests you can do to prevent heart disease.
So the 5 tests, and these are things that you can do right at home. I'm going to give you one that everyone can do right at home.
Okay.
And I think it's a really cool one. So go get some floss. I hope you have some floss at home.
Yes, we should be flossing daily.
Of course. And if you floss your teeth and they're bleeding, that's a very big sign that you got inflammation, that you got some bleeding in your gums. And what's going on inside your mouth is indicative of what's going on inside your arteries. 90% of all diseases start off in our digestive system, believe it or not.
Really?
Yeah. So, and our mouth is the first part of our digestive system.
For sure.
So if you have inflammation going on inside your mouth, that's an important step to come see us, of course.
Okay.
Yeah.
Oh, wow.
So that's number one. I don't know how far we'll get here.
Let's
but
do number two.
Number two, I think, is a very important one, is a good test that you should be doing, and we do this at the clinic, is to look at the arteries in the neck.
Okay.
And the arteries in the neck are important and indicative of what's going on inside the arteries of the heart. And so we do that. We do a cardiovascular age calculation with our clinic, and we determine what the actual age of the arterial wall is. So it's a really cool test. We like to call it, how old is your arteries, or how old is your heart?
Awesome. Number three.
Yeah, number three, I think, is a great one to kind of see how well the arteries are functioning. And so with that test, we look at basically your arteries should be like a garden hose that you bought from Canadian Tire, brand new.
Yes.
Right? We do not want our garden hose to look like it's outside right now. And when you spring and all thaws out, we don't want our arteries to be all that, crusty and not moving very well. That's what we call basically the elasticity of the arteries, or how well your arteries are functioning. So I think it's an important test to look at how well your arteries are functioning.
Don't go away. We still need to hear a little bit more about that. Much more information about your heart health. You're listening to News Talk 770's Talk to the Experts. I am Betty Jo Kaiser. Diamond Fernandez is here from the HeartFit Clinic. Heartfit.ca is their website. Fantastic information there. You can also call them at 403-870-4348. We will be back after this. Hello, welcome back to Talk to the Experts. I'm Betty Jo Kaiser on News Talk 770. Joining me this hour is Diamond Fernandez with the HeartFit Clinic. Heartfit.ca is their website, and you can reach them by calling 403-870-4348, 403-870-4348, or long distance 1-877-700-4348, 1-877-700-4348. Now, just before we took a break, we were talking about 5 assessments. We talked about inflammation. You do some flossing. Gums are bleeding. That's a sign that you have inflammation. Number 2 is at the HeartFit Clinic, they will assess the age of your arteries. And then the third one?
The third one is looking at how well the arteries are functioning.
That's right.
Yeah.
And then we left you hanging, but now we'll get into number 4 and 5.
So number 4, I think it's important. Over 50% of people with normal cholesterol end up with heart disease.
Wow.
Yeah. And it's quite an astonishing factor, because everyone thinks cholesterol is the reason why people end up with heart attacks. So we look at it in our foods, and we look at it, and all that aspect of it. But the fact is, cholesterol is what's inside the plaques of our arteries.
Yes.
And so obviously we want to minimize that. But why is it that over 50% of people with normal cholesterol end up with heart disease? And the reason for it is because it's all about inflammation. And it's all about size of cholesterol. And going to your doctor's office and finding out what your cholesterol is, it's a good start.
Yes.
But determining what the size of those cholesterols are more important. So we all know that cholesterol comes in good, bad, and ugly. So good cholesterol is HDL. We want to see that as much as possible in our arteries, of course. But they also come in 2 different shapes and sizes, a small and large, and I'll get to that in a second. The LDL, which is the loser cholesterol, I call it, we want to see that nice and low, and the triglycerides we want to see nice and low. The point is that cholesterol comes in 2 different shapes and sizes, and the best way I can say it on a radio, of course, is a very simple way, is imagine that your artery is protected by a tennis net.
Okay.
And so I love playing tennis. It's fun. And tennis balls, you have tennis balls, and then you also have golf balls. Okay, so golf balls, if I were to hit that through a tennis net, it would go through there no problem and actually would cause damage. So the smaller golf balls are more dangerous. Tennis balls, which are larger, more fluffy, they will not go through a tennis net.
Okay.
And so the idea is that small ones are more dangerous. The golf balls are more dangerous. And what we do at the HeartFit Clinic is we measure how many golf balls you have. Same thing happens with HDL, the good cholesterol. The small ones are not really doing as much. The larger ones are. So there's a large buoyant type of cholesterol that we have with HDL. That's good. Again, larger cholesterols that are, so not all good cholesterol is good.
Right.
And not all bad cholesterol is bad. And so that's a very important thing to understand, because many people on a preventative level might go on a cholesterol-lowering medication when they actually have a lot more tennis balls, which is not good. And a lot of people that are at risk of heart attacks, and they've been told, okay, they're borderline or normal, have a lot more golf balls. That's more dangerous. And so with the HeartFit Clinic, obviously we determine where you are, but then obviously provide you strategies to reverse that.
Of course. So, but you can determine.
Absolutely.
You are able to do the tests that gives people a better look, a closer look at that.
Yeah.
Okay, and now number 5.
Well, number 5, I think, is a fun one, but also an important one. And many people like to turn our heads when this talks about this, but sexual dysfunction, erectile dysfunction, is actually a big test that you can determine to see what your risk is of a heart attack or stroke.
Really?
Yeah. And I'm going to say this with a serious face for a second, because the arteries going to our sexual organs are a lot smaller than arteries going to our heart.
Okay.
And so if your sexual organs aren't functioning very well, that's actually a marker of heart disease.
For sure.
Or cardiovascular disease. And so that's an important, again, I wanted to leave people with a simple thing that people should be aware of, what their risk is of a heart attack or stroke, a simple test. So obviously the flossing your teeth, and obviously if you have sexual dysfunction, those are big markers for heart disease.
You are listening to News Talk 770's Talk to the Experts. HeartFit Clinic is featured this hour. Diamond Fernandez, of course, with the HeartFit Clinic. You can check out their website, heartfit.ca. Call them at 403-870-4348, 403-870-4348. If you have heart disease, if you've been diagnosed, this is a must. You need to tune in. You go to the HeartFit Clinic, you get this assessment, your team helps determine what you need, and that includes a regime of understanding better diet, nutrition, understanding better exercise, maybe it's beginning exercise, and how you can exercise in a healthy way and monitor your heart function while you're exercising, right?
Of course, yeah.
And of course, stress is huge, stress management. And the big one is ECP, external counter pulsation therapy. And it's the only place that you can get it in our little corner of the world is here at the HeartFit Clinic in Calgary. Wasn't that long ago, people would have to fly down to the Mayo or other clinics in the U.S., but Diamond Fernandez and the HeartFit Clinic offer it here in Calgary. Tell us, Diamond, how does ECP work, and what are some of the benefits that people get from ECP?
Yeah, first off, external counterpulsation, or ECP therapy, is not a treatment for everybody.
Okay.
And that's what we determine, of course, by coming to see us. So, it's an important treatment, part of our treatment process, of course, at the HeartFit Clinic, but we use that in combination with everything else that you mentioned there. So external counterpulsation, first off, I want to talk about it is a safe and painless treatment option. It's not, it's non-invasive. There's nothing that's going into your body or anything like that. And more importantly, there's a lot of evidence. It's clinically proven to be an effective treatment for patients with heart disease. More importantly, it's FDA approved, and it's been done all over down the States and all over the world for that matter. And it's actually a first line of treatment for patients who are actually having a heart attack out in the eastern countries out there. So,
really?
Yeah, and then they got a whole bunch of beds out there, and they put their patients on this bed while they're actually having a heart attack. And yeah, it's amazing. Out in China and Japan, this is their first line of treatment. Those Eastern countries there.
That is
Eastern
phenomenal.
Asian countries. Yeah. And so, but because of the benefits of it and because of what it does. And so it's, again, it's US FDA approved. It's a good treatment option for a lot of people. And there's a lot of clinics. I mean, if you just Googled external counterpulsation, you would find a lot of clinics that are doing it down in the States. And so that's the first thing. And really, who is it for? And so ECP is for patients who do have angina, that do have chest pain, breathless or fatigue. That's what we call considered symptoms of heart disease. It's for those patients who also have small or multi-vessel disease.
Okay.
So what I mean by that is there's sometimes the artery disease. Of course, our arteries, the coronary arteries are a big web of arteries. And if it's a smaller vessel, you might get angina, but they're not able to go in there and do a stent or bypass with that. And same with multi-vessel disease. So you might have, you might have had a treatment of one blockage that's a problem, but you have other blockages that are out there as well that are causing some issues. And so that's what multivessel disease. It's also a good treatment for patients who have a blocked heart stent.
Okay.
And we'll talk about that here in a bit. But, heart stents how long do they last for?
They
That's
don't
a big
last
thing.
forever.
Yeah, and so bypass surgery as well. So patients, you can't really open up the chest cavity again and do bypass surgery because there's, so obviously some increased risk with that as well. And then for those patients who do have heart failure, for some patients that do have heart failure, especially diabetics or circulatory diseases, it's a really good treatment option for patients that way.
What are the advantage of ECP treatment over, let's call them alternative treatments such as chelation therapy?
Chelation therapies, I've seen some patients that have benefit with that, but it's not, there's a trial that came out last year, the TAC trial, and it was showing some hope for that. But I think it's important to understand first, if you are looking at chelation therapy, external counterpulsation would be a better treatment option for sure in terms of helping out with people. But if you do have what we call heavy metal toxicity in your blood, that chelation therapy might be a good option, a treatment option in combination with that. I mean, there's a lot of clinics out in the States. I was in San Diego late last year, and I went to the clinics there, and they do chelation therapy, they do ECP therapy, and they do, obviously nutrition and what we're focused on, what we do at our clinic. But they don't do it on everybody. And so that's what we do. And we don't do chelation therapy at our clinic. And there's a lot of clinics here in Calgary that do that. But yeah.
Is ECP safe? Are there any risks from doing external counterpulsation therapy?
No, I mean, it's completely safe. Obviously, when you when you come to our clinic, we do a very thorough assessment with you to determine if this is a good treatment option for you, because it may not be, right? So.
And is there an age limit? I mean, I know of people who choose not to do surgery because they're older and they don't want to do that. But for ECP?
We have a 92-year-old on the bed right now. So,
that's awesome.
Yeah, and it's nice because, that patient, he started having heart disease in his 50s. And so, and it's a good for people out there that do have heart disease at that young of age, because I still think that's young.
It is.
I mean, this patient's been living with heart disease for 40-ish years, right? So
yeah, that's wild.
Yeah.
Quickly before we go to break, how long do the treatments last? And I guess it depends how many you get.
Yeah, and you basically lie comfortably on a bed, and there's those series of cuffs that pump blood back up to the heart, and you do that for about an hour each time. And we usually do treatments around, depends on the patient, but around 30-ish.
It's pretty relaxing too, right? It's just lying on a bed and having your legs squeezed.
Yeah, and some patients, can sleep through that treatment, and
Awesome.
and some patients, obviously are awake during that treatment. It's not a big deal, but yeah.
Okay, when we come back, we're going to talk about how long a heart stent actually does last. You're listening to News Talk 770's Talk to the Experts. I'm Betty Jo Kaiser. We're chatting with Diamond Fernandez from the HeartFit Clinic, heartfit.ca or 403-870-4348. Back after this. Hello, welcome back to Talk to the Experts here on News Talk 770. I'm Betty Jo Kaiser, and joining me is Diamond Fernandez with the HeartFit Clinic. Their website is heartfit.ca. Their phone number is 403-870-4348. That's 403-870-4348. Or long distance, 1-877-700-4348. That's 1-877-700-4348. If you have heart disease, you need to listen up to the next 10 minutes. Diamond has some very important information. If you're somebody or you know somebody in your family has been diagnosed with heart disease, you need to stay tuned to this. And one of the questions that I have is the difference between a heart stent and a bypass surgery. When do all of these things come into play?
Well, I think it's important to understand when we should have these. And of course, some of our listeners have already had this. And our focus is a lot different now than it was, even 10 years ago, when people have had a heart stent or bypass surgery. Heart disease is obviously a disease that likes to progress. It likes to get worse over time. And so it's a difference as to whether you've had that heart stent or bypass surgery as a result of a heart attack, or have you had that bypass surgery result of a certain disease process? That's what's going on. So let me elaborate on that a little bit more. There was a study that was done. It's called the COURAGE trial, and you can just Google that. It's COURAGE, like a courageous lion, I guess. But anyway, COURAGE is the trial. And what it did is it compared the benefits of using optimal medical therapy versus having a heart stent in patients that have stable coronary artery disease. Okay, so what it showed is that optimal medical therapy is just as good as having a heart stent. And there was another studies, there's lots of studies out there comparing heart stents to exercise, even to exercise therapy.
Okay.
So the reason heart stent only focuses on a small little segment of the arterial wall. If you have heart disease, it's probably a disease all throughout the artery, but it only focuses on one little section of the arterial wall. With exercise, with medical therapy, it's focusing on the whole arterial wall. And so we're not just focusing on that little segment. And exercise, in my opinion, is the best medicine.
Okay.
And it should be taken regularly, daily. And,
Yes.
It's more important, in my opinion, than any other medication out there. And so, and that's what we focus on in our clinic, is to make sure that you can do that safely and effectively at the HeartFit Clinic. That's what we focus on. So it's important to understand whether you have what we call stable coronary artery disease or you have unstable coronary artery disease. If you have stable coronary artery disease, there are other options. External counterpulsation being one of them, exercise being one of them, obviously eating well, stress management. You're going to get way better outcomes. It's all about outcomes here.
Right.
You're going to live longer by focusing on what we do here.
Better
at our clinic.
results.
Better results.
Right.
Now, if you have what we call unstable angina, that's where a heart stent might be of benefit to you. Or if you had a heart attack where it needs to be opened up right away, that's where a heart stent would be a benefit to you. And that's where the research shows. But even then, this is where what we do at our clinic, focusing on lifestyle interventions, are more important to focusing on just that one procedure that took an hour to do.
How long does a heart stent last for?
So I think the important question you should be asking is really how long does the heart stent last inside the arteries? Because the stent will last for a long time. The problem is that what we've done with the heart stents is we kind of balloon the artery and we push the plaque out to the outside, and now we have an open artery to that flows well.
Right.
The problem is that there's still heart disease on the outside of that stent, and it likes to come inside. And heart stents, I've seen them last a long, long time, but I've also seen them last only a few months. And obviously, it depends on where your artery's situated and what kind of how well your artery's going to take to that heart stent. At the end of the day, it's a foreign object going on inside your arterial wall. So, it depends. Is your body going to accept it? Is it not going to accept it? Is it going to amend to that arterial wall very well? Is it going to keep it open? Those are all questions that are difficult to answer. But where I see the most concerns or the problems with heart stents is really at about that 5 to 7 year mark. I start to see some concerns with the heart stent.
For sure.
Yeah.
It's not a lifelong.
No.
Stents
Stents and bypasses do not cure heart disease. Do
That's
not cure
right.
what we call atherosclerosis, which is the plaque buildup inside the arterial walls. Heart stents and bypasses do not do that. What it does do is it alleviates patients that do have severe unstable angina, or it does relieve those patients who do have what we call left main disease, which is the widowmaker in layman's terms. That's where a bypass would be a great benefit. Or for those patients who have unstable angina with maybe even a heart attack. So that's where heart stents will show its best outcome. But what's even more important than that, I think is way more important than even having that heart stent, is focusing on what you got to do afterwards.
That's right.
Yeah.
Yeah. And that's on one side, it's prevention, and the other side, it's improving your lifestyle so you don't go back there.
Absolutely.
You don't want to be back in the hospital.
And, external counterpulsation therapy might be a great option for patients that do have coronary artery disease. Basically, it reverses the effects of what's going on inside your arteries. It grows new arteries, increases stem cells and nitric oxide, which is important for improving the inner lining of the arterial wall. So that's really important with that. Obviously, we've had patients on there that decreases and eliminates their angina, minimizes medications, dependency on some medications for patients. Obviously, I can go on and on.
Well, and it goes. It even. I mean, yeah. If we're gonna be listing all the merits, it goes beyond heart disease. People that have diabetes.
Absolutely, and that's the best outcomes we see with patients is patients who do have diabetes and heart disease. Because 4 out of 5 diabetics end up with cardiovascular disease. It's just unfortunately what happens. And so, that's a really big thing that we focus on.
I'd just like to know, Diamond, because you meet people all the time and you always light up when you talk about the great success of your clinic. And of course, it's the full package, the people that work there and the different testing and the treatments that you offer. And we do focus on ECP, external counterpulsation therapy, mostly because it's the one place in Calgary that you can go. Mm-hmm. Before you guys opened, people had to fly down to the States to get the therapy. So it's specialized, it's well proven, it's awesome. But I want to hear about the difference when somebody walks in to your clinic and says, "Help me."
Yeah.
And after they have gone through the treatments, the assessments, and all of the treatments, what's the difference? Paint a picture for us.
Well, it's the consistent compound effect of doing the treatments where people see the benefits. It's not like, I ate a fruit once and you expect to see.
I felt great after that kale salad.
Yeah. And so it's the repetitiveness of anything that you do. And that's where it's important. And I talk about it, of course, in our book is mindset is one of the most important pillars of heart health for us. And setting the right mindset and attitude to be able to keep that daily discipline of what we're going on. So after even continuing our treatments with external counterpulsation with our clinic. But, when you can see patients, we have a little ramp that you come up our clinic, and obviously it's it can be a challenge for some of our patients that going up it, but that's a really good test. When we see patients able to walk in from the parking lot without any angina, walking up the ramp, and they're starting to notice these small little changes. I mean, I love that stuff. And I can't attribute it to anything else because it's happening very quickly.
Yes.
It's happening within weeks right
before your eyes.
Yeah, right before my eyes. And patients are not having as much angina anymore. They're feeling a lot better. And I don't mind sharing this because we talked about it as an important test, but, they get improved sexual function, which is important because some of the medications might have, depleted that aspect of it. So improved sexual function is important. And, giving that to people, giving just their things that they want to do in life a lot better. Back in the summer, they're able to walk a golf course. That's a huge thing for some patients to be able to walk a golf course.
Their lifestyles completely change.
Yeah. And so here in the winter, there are not very many activities, of course, that we can do outside. So it's hard to test it, but really patients be able to walk in from the parking lot. I love to hear those stories. I mean, they're able to feel a lot better. They're sleeping a lot better. Their stamina's increasing. All that stuff is happening within weeks. And I love that stuff.
And it's credit to you and your team.
Yeah.
That's the group at HeartFit Clinic. HeartFit Clinic here in Calgary. The website is heartfit.ca. I'd love you to pop online and take a look at their website. On the homepage, scroll down, and you're going to see a chart. And it shows how HeartFit Clinic bridges the gap. It explains navigating the healthcare system for heart disease. It's very clearly laid out, and it will give you just a really good understanding of what's going on with heart disease and the arterial wall, the stuff that Diamond has talked about. Sometimes it's a little bit hard to picture in your mind, but I love how the website walks you through it. Again, that's heartfit.ca. If you would like to go in, have a chat, talk about an assessment, you can also call 403-870-4348, 403-870-4348. Outside of the Calgary area, 1-877-700-4348. That's 1-877-700-4348. You've been listening to News Talk 770's Talk to the Experts. I'm Betty Jo Kaiser. Have a great day.